I was very hard on myself when I moved back home, and really had to like dig deep, like, right, like get like a little spiritual, right, and like figure out like not only what is next in career, but like what does Shel want? What makes Shel happy? And I'm very grateful for that time home. It was again one of those transformational things, but it didn't feel transformational. It did not, I loathe telling people I moved home. People were like, oh, Shel moved home. Like, wait, Shel is back in Charleston? Yeah, she's back in Charleston. You know what I mean? So I didn't like publicize it at all because I was embarrassed. I was ashamed. I had friends who were, I was going to their ceremonies for 30 under 30. And here I was back home with my parents, not knowing what was next. So it was rough, but it was I think what I needed. It was a part of the journey, right? I always say these things, I go back, it was just a part of the journey. And it makes sense now, but man, it did not make sense then.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 103. Hi everyone, Omari Richards here. Be sure to follow me at the PH Millennial on Instagram. Be sure to subscribe to this podcast, leave a 5-star review, and share it with a friend if you had not done so as yet. As well as if you're interested in some merch, you can go to the phmillennial.com/shop and check out some Public Health Millennial merch there. But I really enjoyed today's episode. A lot of transparency, a lot of ups and downs. And I think this is an important conversation and an important story to tell, so that you all are able to know and realize that even when you're down, there are so many people that are there for you, that are supporting you, to push you, to give you that foundation to elevate and take you to that next step. And this story has a lot of resilience in there, and I think it's going to be something that a lot of you all enjoy. So without further ado, here's today's episode. Today, we have a dynamic, goal-driven public health professional experienced in community outreach, patient care, project management, and research. She got a Bachelors of Science in Biology at the University of South Carolina, Columbia. She then worked for the Columbia Urban League and in a patient care technician role before getting her Master of Public Health at the George Washington University. She currently works as a patient engagement specialist at the Epilepsy Foundation. We have Shel Lessington, MPH Ches. Welcome to the show.
Yay, thank you so much. I'm so excited to be here and talking with you today. I'm like very excited. Any opportunity I get to talk about public health and my very bumpy journey, but very rewarding journey in public health, I am always available. So I am excited to talk today and talk through everything.
Well, we are lucky to have you because I think every bumpy journey has like great insights and learnings that you can share with others. So I'm looking forward to diving into that. So awesome. How are you doing? And then tell me how you've been coping during these times.
Yeah, no, thank you for asking. I think that question sometimes gets lost, right? It's like sometimes let's like get into it and we forget to ask like, how are you? But I am doing good. I am happy. I am healthy. The pandemic did have some very rough times. I tell people that I am an extrovert. I am not like, I'm not an introvert, extrovert, or however, people add the two. I am an extrovert. And so it was very hard for me during the pandemic, being in my house, realizing, kind of being with my own thoughts for a while and not being out with people, because I get a lot of energy from people. People energize me. I love that. So it was difficult, to get through that. But I think, now, kind of got a good grip on it, and life is good. I'm living in Houston, Texas, and enjoying the weather before it gets very, very hot. So I am doing good during these times. So I thank you for asking. How are you?
My pleasure. First of all, glad that you're doing well. Yes, enjoy the weather before it gets hot. I'm also doing well. Happy, glad to be interviewing people, sharing more stories. Personally, I just feel like very refreshed. I feel like I'm in a good place with both like my work, personal life, with the podcast and Public Health Millennial. So I'm in a groove. And feeling good.
Yes. I love that for you.
Thank you. And I'm glad that you're able to get more interactions with people and get that energy that you definitely seem to need.
Yes, it feels good. It's good. I'm enjoying it, and I'm enjoying being in Houston and meeting new people here because I'm new to the city a little. So yeah.
Okay, awesome. So tell me, how do you identify, and tell us a little bit about your personal background?
Yes, for sure. So thank you so much for the questions. My personal background, this is the question I am always like, what can I say about myself, right? That's not on my resume or not, who I am. But I always start with like, Shel is this little Black girl from South Carolina who was a dreamer, who really didn't know what she wanted to be and what was her goal in life, but she knew she was going to be something. She came from and sometimes it's crazy to talk about yourself like that, right? Like she was and she is. But I think it is important for me to honor that little Black girl that was growing up, that wasn't so sure about herself, or like wasn't very like aware of her surroundings. And so I always go back to that and I honor her, because she would be very proud of, what I'm doing, how I'm standing up for myself, how well I talk about myself and around people. So yeah, Shel is from South Carolina, grew up all of her life in South Carolina, is the oldest of two sisters. Very small family, grew up always very energized, athletic, and just an all around, I like to say I am all around. I bring energy to people, because you never know the smile. So I always wanted to help people. That was always what I wanted to do. I told my mom that. I remember I was telling her, like, I want to be a teacher. I want to be a police officer. Like I was that kid, right? Like I want to do this. I want to be a princess. But no, I want to be a firefighter, because like they're cool and like boys do that. And I want to do that because I want to also like be like whatever I want to be. And my mom would be like, you can be whatever you want to be. So, I grew up in an environment that allowed me to really just flourish and be what I wanted. And I went through life like that. So I went through high school, went to a really rigorous high school, really learned very fast on that, like school is a lot, had like I'll never forget it. It was a European history class that like blew me, like would be studying for hours, going into our 12th grade year. We had to read 11 books for summer reading. I will never forget that summer. I was like, wait, why am I at this school? And like, what is this doing? But it really prepared me for, high school. I mean, it really prepared me for college. And so I was in the mindset that I wanted to be a doctor, right? Like that's what I was taught, right? You want to help someone, you want to be in healthcare, you go be a doctor. So I went to get my bachelor's in biology. I thought that was the best route. And biology is a doozy. Biology is by no means easy. I learned very on that these classes are very hard. And it's a lot of, just studying and memory. And I felt like I lost a lot of my creative side when I was in college. It was Shel, go study, go memorize this because you have a test tomorrow. And so I struggled. I think I was all over the place. So I took the PCAT, left the class, left the test, was like miserably crying in my car, did not take the MCAT. And then it was like time to graduate. And I go, OMG, what am I going to do? Right. Like this was back in, I don't want to tell my age. This was back in 2010. I graduated from college and I had no idea what I was going to do. Right. I had this biology degree. When you go online and you really look up, I laugh now. You look at like jobs with the biology degree, you see like, oh my gosh, I think it was like gardener. It was like something like biologist, but you were like biologist that you work in a garden, botanica. I can't remember exactly what it was, but it was just like things that I was like, wait, Shel, this is not what you want to do. So what are you going to do? And I struggled, right? Back then, everyone was still now and is like when you graduate from college, it's a beautiful thing, right? You take pictures, you already have your next job assignment. You're either moving out the state or you're going to another graduate school, or you're going to medical school, or you're going to law school. And that was not my journey. And so I had to figure it out. And I didn't know. So I had a friend network. I always tell people your network is always going to be it. I had a friend who said, Shel, I work at this Urban League. It's a nonprofit. They have this job opening. I can't tell you much, but it's a job. And I know you need a job. I go, well, yeah, I need a job. I've been in my apartment for like 2 weeks trying to figure it out. So yeah, like let's interview. interviewed, and I was like, okay, this could be a great like entry to like public health. At this time, I still didn't know what public health was, right? Like I knew, oh yeah, you can help people, but in terms of the study of public health, I had no idea. And so the program, which can get into, was the Urban League, Columbia Urban League, and it was an I Am Woman program. So it was an opportunity for you to work in a community of in Columbia, South Carolina, working with women to help them be better managers of their care, right? They were either diabetic, they had hypertension. So we came in, we had a curriculum from Morehouse School of Medicine. We had curriculum sessions, and then we had Zumba come to their community. So we would go in their community, do the educational trainings, do the Zumbas, and really try to see if we see like lifestyle changes, see if we see, perceptions changing, the habits changing. And it was a great learning experience, but it was hard, you going into these communities with, these ladies. I think I always said, like, I was 23, like I was college educated. I didn't have any kids. I'll never forget her. To this day, I really hope she's doing well in Columbia, but it was Miss Cynthia. Miss Cynthia, I was like talking about salt one day. Like, I don't know, it was like a session about how much salt you put in your food. And she was over it. She said, you know what? What are you talking about? You don't know what you're talking about. You're 23. You're coming in here telling us every single week what we need to do. You don't know how we live. You don't have any kids. You got your degree from over the school over there. I mean, she just literally laid it in me, and I was like, you know what? She's not lying, right? Who I have to build a certain type of trust to work in these communities and really like meet people where they are. And some stuff started to click. I'm like, okay, public health, I kind of see what you are, but I don't know quite yet. I'm still going to go through the fields. And then I got like the project management space, right? At 23, right? You're over a project. You got to think about budget. You got to think about deliverables. How are you getting the deliverables? If you are not getting the deliverables, what have you guys been doing? Writing your reports and everything. And so that was interesting. And I worked there for 2 years, and I said, okay, I think I want to go into public health. But then again, I thought about like going back into healthcare, right? Like, so it was.
I want to stop you. I'm going to stop you there. So, no. You're fine. You're fine. You're just going into a lot of great information there that I don't want to miss. So first of all, I just want to say, like, shout out to you. Thank you for sharing that. And it's very helpful, I think, for a lot of people, especially people like yourself and myself went into school as biology, wanted to help people. And I think that's the tragic thing about a lot of biology majors. If you don't end up going that medicine route or something like that, it's really challenging to find something where you're actually going to help people as like, because that was a driving force for you wanting to become a biologist. Same for me, because you want to become a doctor to help people, but we don't know about public health. But thankfully, you're able to find that out later on. Okay, so before we get back into your story here, what does public health mean to you?
Wow, that's a great question. It's very short and simple, right? I think of equity over equality. No, let me say this the right way, because there's a lot of buzzwords in public health now, right? Like social determinants of health, disparities, like all this stuff. But I really think when I think of public health, I think of equity and I think of equality, right? Making sure that everyone has all access to anything to make them better. I think everybody has the knowledge, or if they don't have the knowledge, there are resources that they can get to be the best managers of their health, regardless of what that is, right? Whether that's a provider, a doctor who is going to help prescribe medication, whether it's somebody working in the community who needs a resource because they don't have transportation to their appointment, or it's really a community health worker, right? I think public health is so vast. That's what I love about public health. So, public health means a lot to me. I think it shapes our community, it shapes policy, it shapes everything around us. Just because, even though you didn't study public health, I always tell my friends, just because you guys don't have an MPH doesn't mean you aren't a part of public health in communities and bettering our communities. And so public health is vast, it's beautiful, and we need everybody to be a part of it to really, really move it forward and really see some real changes in our communities and healthcare.
Yeah, absolutely. And I can't underscore that, just how much public health is intersectional in so many different things that people just don't know or don't think about. But then when you learn about public health, you're like, oh, I see it there and I see it there. And it's like actual real life examples of like what's going on here. And I think it's the exposure to public health, I think, needs to really come earlier in life, and I hope there are more programs and pathways that are forming there. But thank you for that definition. Okay, so you said you went to a rigorous high school, read a bunch of books during the summertime, which you're not too enthused about sharing. So what was the thought process going into undergrad with your Bachelors of Science in biology? Was biology like your thing that you knew that you were going to go and pursue because you wanted to become a doctor? Was that like definite going into undergrad? And just so everyone knows, you went to University of South Carolina, Columbia.
Yes, yes. So also it's another part of the story too, right? I went to an HBCU my first year. I went to Hampton University my first year, and I actually majored in English. I majored in English then. And then I changed from English because it was too much paper writing. I was like, oh no, I'm not spending another semester just writing papers about my thoughts. And so I changed my major to pre-pharm at Hampton. Hampton had this really great program that, you do your 2 years, you do all your, your prereqs, and you automatically get into the program if you do well, right? It wasn't back then of the, you take your classes and then you apply to pharmacy school. Hampton had it where you do the prereqs, you do well in these classes, and you automatically go, right? I mean, and of course, like taking your PCAT and everything, but it was transitional. It wasn't like how a lot of the programs are now, right? Where you have to actually like apply and go through this like rigorous process, which, I think about it now and I'm like, dang, I wish I would have stayed at Hampton, but I left Hampton, unfortunately, because it got too expensive for my parents. I love being away from home sometimes and meeting new people and being outside of my norm in South Carolina. But I knew I had 2 younger sisters that were coming behind me that were going to college, and I didn't want my parents to struggle with school. So I decided to come back home to South Carolina. So here I am, just like pre-pharm, and I go to USC and things are completely different there, right? This like big, state flagship school. And they're like, yeah, you could be pre-pharm, you take your classes. Some of these classes went over and you have to apply to pharmacy school. So that's why I took the PCAT, and I like miserably cried after, because I was like, wait, this is too much. I don't know if I want to do this. And I wasn't very aware of what it took to become a doctor or what it took to become a pharmacist. I just knew I wanted to help, right? And I think that may have been, it led me in a lot of different directions, very beautiful, a beautiful journey, but I wasn't sure. I just was a person who had a big heart, wanted to help people. And in my mind, helping people meant being a doctor. And if I wanted to be in healthcare, I didn't think about any other even profession other than a doctor. So I took prereqs, all the organic chemistries, the physics, oh my gosh, the anatomy and physiology. Ooh, I have PTSD just talking about it now, right? And they were hard classes, right? Like, I think I want people who are in these biology programs to really give themselves like a huge like pat on the back, or to give themselves a hug, because when you think about taking all those science classes in a semester, that doesn't make sense to me. You're taking like 12, 14 credits of organic, the first anatomy, then you're taking physics, then you may be taking stats or econ. Those are very hard classes, so I look back and I'm like, how did I do that? And then maintain like life outside of that, right? And being in college and being involved and being in student government and, all the stuff. I have no idea how I did it. I did it though, right? And I just changed my major to biology because I knew I didn't want to be a pharmacist. I took the PCAT and said, nope, don't want to be a pharmacist now. And so let me just go do the biology route. In high school, math and science, I was pretty decent at, right? So I was like, oh, well, biology will be pretty easy. Found that out that wasn't the case. But I just thought that was the route and I would figure it out, right? Like, I don't know if I put a lot of energy into trying to figure it out, but I was like, oh, I'll figure it out, right? Like, I'm going to go through and take the classes. And by the time I graduate, I've already known what I've done. And so I graduated and didn't know what I wanted to do. I didn't even understand how you get into med school. I mean, I know you take the classes and then you take the MCAT, you apply, but in terms of like having like even like background experience, I didn't have that. I couldn't have a job in college. It was school, right? I couldn't even imagine trying to get experience in that space when I know there's a lot of kids who do it now, but back then I had no idea how I did that. So I graduated with no job, no like thought process of what is next. I think, it's funny now, I laugh now because I'm a little bit older, but I think I took what like the newer generations are so the gap year. I think I took a gap year and didn't know it was a gap year. I didn't call it back then. It's just I didn't have a job, and so I didn't know what I was gonna do. But now they have a cool word they have a cool terminology called gap year. So I think I took my gap year back in 2010. So thank you for that word, because that's amazing, like transition. But I took that off to figure out, and that's when I started working at the Urban League, and things started to come together in terms of like public health or where I wanted to go. But I was still on the fence about like, could I get into med school? Like, was that still a thing? And so I worked at Columbia Urban League, learned like a lot of valuable lessons about working in the community and what it means to build trust and build relationships in communities, and, the wording, right? Underprivileged, low income. I hate those words. I just say community, a community of people who need information, who need knowledge, who need education. It's not that they don't want to do or be managers of their health or be the best they can be. They just do not know, right? They have these institutionalized like thoughts in their minds or things that they've been told that's been brought down from family to family that makes their actions and the things in terms of food and how they see food or how they see exercise a thing. And so, you build that trust, you go into these communities and you learn about them, you let them learn about you, you open yourself up, you become vulnerable. I think public health has really, really made me very vulnerable in a space because, people are, we are humans, we are, people of habit. And I believe everybody, I say this all the time, but I believe everybody wants to be the best. I keep saying this again, but I think everybody wants to be the best managers of their health. Like, I don't think anybody just says, oh, I want to have diabetes. I want to have hypertension. So you have to have people come into the community who know the community, who understand the community, who really, really want to help and know that it's not going to happen overnight. So I learned that in that role at the Urban League. It was great. I'm so grateful that it came into my lap. From my friend who was working there at the time. He was doing tech work at the time. And he said, Shel, this program's here. You better apply. I'm like, okay, I'm trying to apply. And it ended up really being like my introduction to public health and community health. But in the back of my mind, I'm going to be honest, I still thought about a doctor, right? And I also thought about how much money doctors make, right? Versus public health. That came up again in my thought process. And I was like, well, Shel, you got to try, right? Like, you got to at least see if you want to be a doctor. That's a lot of money. I mean, it's a lot of school too, but it's also a lot of money when you look at it. So Urban League was over and I moved back home to Charleston. So that was a big deal, right? No one was moving back home back then. And I felt, if we want to be honest, and, I feel like I can be transparent in space, I felt like a failure, right? Like back then, you don't move home, right? Not when you're 25, you 20, was I 24, 25, 20? I was in 24, I think. I moved back home with my parents. I just needed to regroup. I needed to refocus, being in Columbia where I went to school at with people that I knew. I felt like I was like losing myself. I was getting very complacent in like just what it was. And I wanted to get back to a space where I started to like pour more into myself. And I think I needed to move home to do that, right? To clear my head, get back focused, and really dive into what I wanted to do. So I moved back home and I started working at, as a patient care tech, which is really a CNA, but it's at a hospital. Worked at a med surg, a very high intense floor, saw a lot of different, I think what I usually would see most is like our cystic fibrosis patients, sickle cell patients, people, unable to move, and you are there really to provide support for them, right? Support in, their daily living, making sure they have the things they need. And I really love that job. It was very humbling, let's say. I worked that job. I didn't need my bachelor's of biology to have that job at all. I didn't need any of that. I only needed my CNA cert that I got like 3 months. It took me 3 months to get it. It was like a program that they had at a tech school, and I did it, but I didn't need my bachelor's. And so it felt like a step down, but it also felt like I was going to really learn and see like, okay, what is going to be next? And I loved being there for people in that way, right? Like, I wasn't administering medicine. I wasn't making decisions about people's care, but I was there to help them in their need. And I was able to see bedside, how you interact with people bedside and how you build trust in that way, right? So I started thinking about like public health again, but it also still the clinical field. And I did that for like 2.5 years because I wanted to get one. I realized then like, okay, Shel, if you want to go to med school or you want to go anywhere else, you got to start getting some hours, right? You got to get those hours that they want. So I was like, you got to get these hours. So I think I ended up getting like 4,000 hours. And I was like, Shel, what is next? What are we going to do? Are we going to apply to med school? PA school had peaked in because I just found out about PA school, never heard about PA school in undergrad. And then somebody said something about a physician assistant. And I go, oh, physician assistant. Oh, 2 years. It's similar to med school, making, similar money, not as much, but, maybe that's a thing. And my heart went back with public health. I was like, Shel, let's go to grad school. Let's go to grad school. Let's get our master's of public health. Let's learn more about public health. You know what you know from working at the Urban League, but you don't know like the deep of it, right? Like the planning of how you plan something in public health, the intervention, right? The policy behind it. I did not understand all of that.
Let me pause you there. Let me pause you there once again. No, I appreciate the passion in the story. I just want to make sure I'm like highlighting certain points because I agree with you. Like biology degree, myself. I didn't know like the process of getting to medical school wasn't something that someone actively spoke to me about, like getting those hours and that research experience and those things. No one told me about. Biology, the degree itself is definitely one of the most like time intensive undergrad degrees that you can get, just so people understand that. So it definitely
Amari,
is hard.
quick question. If you could go back, what would you get your degree in undergrad?
I'd probably try to get public health.
Yeah.
Or I might even do like something like weird, like, well, not weird, but like business or something like that, and still go into public health, or just like not biology, but here, but here we stand today with the biology degree.
Here we are.
Yeah. And I also wanted to highlight the points of you saying that everyone wants to live their best life. It's just that we are creatures of habit. And I would add to that, we are creatures of our environment. And as well as all the systemic barriers and all the systemic narratives that come down onto us to tell us, okay, this is what you should be doing, this is what you shouldn't be doing. It is hard to achieve like best health, optimal health in Western culture, Western view of life. And as well as, I think it was great that you highlighted that you took your gap year before you knew it was a gap year. And it seemed like it was very fruitful in helping you not only like think through. Tell me what was fruitful about the gap year?
Yeah, I mean, I really started to like be like, okay, Shel, you this is a career. This could be a career for you, right? And it looks very different than like a lot of your friends. A lot of your friends are now working at like these Fortune 500 companies, right? They're in business. They're either in law school. I had a friend at the time who was like working her way up in property management. So like I was seeing them like in their career, and in that gap year, I feel like I really found my passion, which is public health and still helping people, but in a way that I felt like I could still keep Shel, but also still be helpful, if that makes sense. So it was fruitful. I mean, I think also I got some time to like take a deep breather, because being an undergrad, it's hard, especially I think a bio degree. I look back and I still to this day do not know how I did that. I remember having really rough semesters, like organic 1 and organic 2. I mean, those classes made me cry every single night, like studying. I'm like, this stuff does not make sense to me. So I really have some time to like sit back and like praise myself, right? Be like, Shel, you did what you could do in undergrad, right? You did all that you can do, and this is how you move forward. And I kind of did, what are next steps for me? What does my 5 years look like in that gap year? And it was great. And that job falling into my lap, I don't think that was by chance. I think that was supposed to happen that way to really lead me into the direction of where I could go next in my career.
Okay. And tell me, you were saying earlier in the preview of like a lot of your journey, you were saying that you came into this position and this lady was telling you, you're 23, you don't have kids, you don't know this. How did you overcome that?
It was hard. Let me say, I was like, I'm quitting this job, but I couldn't quit this job because I needed to pay rent, right? But I sat with it, right? I talked to I had like mentors. I had people that I worked with. I had an amazing mentor who actually worked at Morehouse, who was a part of the curriculum. And she said, Shel, like this happens, right? Like this isn't, I've seen this before. I took it very personally. I thought it was like a personal attack, but it wasn't. It was really just the way in which relationships are made in communities, and sometimes how you start to go look and do research. A lot of people come into these communities and think they're going to be the change makers and they're going to do all this great work and make people change, revamp their lives. And, sometimes that's not the reality. The reality is you have to like meet people where they are and, humanize yourself, right? Don't come in there like, this is what we're going to do today. This is how we're doing it. Like, no, Shel, like still be yourself and like, let these women know, hey, what you're here for, who you are. I think once I finally like got the courage, which was a lot when you're 23, right? Get this courage. I didn't have a background in public health or even project management, if we want to be honest, right? I was a biology degree. I had a meeting with them. I sat everybody down and I said, I wanted to make sure that I addressed the situation. And I said that like, I don't want you all to think I am coming in here to change your lives and make you better people, because I already think you are amazing individuals. I am here just to really give you information and knowledge about the education of food and how we see food. And it started to be a we and not a you guys, right? I started to change the words that I said. It really was transformational for me in public health. And I'm glad that it happened then. It was rough because I was so down on myself. I thought I did something completely wrong. But that's when I realized, like, Shel, you need to be in the community. Not everyone can work in communities, right? Like some people have it. I think they said it about doctors, right? Seeing somebody that looks like you. And I thought that, right? I thought, I'm a Black woman. I'm going to come in here and they're going to love me. No, that was a reality too, right? That was something I was like, oh, okay, it's not that easy. And so it really made me look about what it meant to live in these communities that they call low income, and what does that mean, and who are the people that are inside of these. And these people are not a part of, like you said, we talked about, right, these systemic like structures and policies that have allowed people to live the way they live. These are not who these people are. They are individuals. They want the best for their families. They're just doing what they can do. And if health isn't a priority, then Shel, you come in and you show them like, hey, this is what you do. I started, instead of just being at Zumba classes, I started doing Zumba with them, right? Just like really little things. They're like, okay, I see her. She's getting a little bit more involved, right? Like I didn't see it as a job anymore. I saw it as really like, I am here to be with them, right? I'm learning about health too. Like the curriculum was amazing from Morehouse. And so there were certain things that I was learning as well. And so I just started to be more personable. And that was like really, really the best part of that job. And that's why I think public health is like ingrained in me, because I had that understanding early on. And I take that story with me all the time, right? That happened to me when I was 23. I am older than that now. But that story defined my public health career. And I always tell people, go into these communities is not easy. You can't just make something work and it clicks. Like it's going to take time. It's going to take building relationship and trust. And that's I think that's it, right? Did I answer that question?
Yeah, you absolutely did. You absolutely did. And the other question I wanted to ask was, you said that after your time in the Urban League, you moved back home with your parents, and you said that was a humbling experience, but it definitely seemed like it was grounding and helped you to really ground yourself in like what you wanted to do moving forward. So do you want to talk just a little bit more about that?
Yeah, no, for sure. Moving home, back then no one was moving home. I think during that time, like that's the age of when like the 30 under 30 was happening, right? Or like that was like that big era then for me and my friends. And I was like, oh my gosh, people are getting like you know, the comparison, right? And Instagram was like not around when I was in college, but then like after college, it was like this thing, and people were posting all their accomplishments and like getting brand new houses at like 23 and 24. And like I'm like, oh my gosh, I'm moving back home. Like and I don't even have a career. I don't have I barely have a job. I'm about to go work at a job that I'm making very little money, but I'm going to get experience and I don't even need my degree. I think, you know, I think a little part of me had, it was a little bit depressive. If I'm being very honest, then, I can't call that what it is now because I never, went to, a doctor to figure out what's going on. But I was sad. I was sad. I didn't know what was next. I went home. I would work out every single day. That was like a way I relieved stress. But I think society, it was big to have all these accomplishments before you turn 30. I mean, I think even when I think about growing up, it was like, you do this at 21, you do this at 25, you do this at 30, and you think like that, right? And so when you don't have that and you see other people around you doing it, you're like, well, what am I doing differently? Like, why is this not happening for me? And so I was very hard on myself when I moved back home, and really had to like dig deep, like, right, like get like a little spiritual, right, and like figure out like not only what is next in career, but like what does Shel want, what makes Shel happy. And I'm very grateful for that time home. It was again one of those transformational things, but it didn't feel transformational. It did not. I loathe telling people I moved home. People were like, oh, Shel moved home. Like, wait, Shel is back in Charleston? Yeah, she's back in Charleston. You know what I mean? So I didn't like publicize it at all because I was embarrassed. I was ashamed. I had friends who were, I was going to their ceremonies for 30 under 30. And here I was back home with my parents, not knowing what was next. So it was rough, but it was I think what I needed. It was a part of the journey, right? I always say these things, I go back, it was just a part of the journey. And it makes sense now, but man, it did not make sense then. So I tell people, just keep going on your journey, keep like feeling the feels, do what is on your heart, pray about it, and then just keep moving, always staying steadfast. But if it doesn't make sense, it will make sense eventually.
Yeah, and thank you for sharing that, because I think that is important for a lot of people who might be in that same path or having something very similar, to know that, just because I'm moving home, just because I'm taking this job that doesn't require my undergrad degree, doesn't mean that I'm regressing, but it's just a part of where I am right now to build up, to go further. And I think everyone can choose to be like the winner or the loser at that point. And for you, you kept on pushing and kept on saying, okay, well, I mightn't feel happy, but I'm going to continue to do this because I know this is part of my process to get where I need to go. And that was public health. So you got your patient care technician job. Okay, actually, I wanted to ask, when did you hear about public health? Was that during the Urban League? Because you said you came out of a biology degree, you had no clue what public health is. You were seeing jobs like microbiologist and botanist and agricultural gardener. So tell me about when you heard and learned about public health.
Yep, I heard about public health really through the curriculum at Morehouse School of Medicine, right? The woman who worked there, who was a part of Morehouse, who came to do like our training, she had her MPH and her MBA. And I'm like, wait, what? Like, I think that's the first time I really heard about a master's, like an MPH and MBA. I don't remember vividly hearing about that in college, especially not with a biology degree, right? I didn't know that was a thing. So I, would ask her certain questions about public health, or just like reading the materials or the curriculum, and like understanding like, the essentials of public health. I got introduced to like the CDC. I never, it was like, wait, what? Like, and like the research part of it, I'd never heard of it, but being a part of the curriculum and being a part of that initiative with Morehouse and the Urban League, that's how I learned about public health. And I said, oh, people like get masters in public health and they do this work. And she's like, yeah, Shel, like I do this work now and I love this work. She was working at Morehouse. They were like, it was like their urban initiative. So she would create programs. She was a part of creating programs for communities, right? For, communities, like low income, whatever the word you say, underprivileged. I hate, I don't even, sometimes I don't use those words anymore, but when you look at it in terms of like research and public health, those are the words that they use, right? And so she was like, I create programs for them, Shel, and I love this, right? But I had to get the experience and education about what public health is and how public health works to be able to do that. So I go, oh, okay, public health, okay. And like, she was like, I was very like fangirling over her. I just thought she commanded a room, the way she like spoke about public health, the way she would train us. She was very personable. I was impressionable. I was 23 and I was like, oh, I love how she's leading this, but she's also talking about like health and like being like, going to the community and like changing the things and being steadfast. And she just used all these words. And I'm like, oh my gosh, like, I kind of want to be like her. So I started looking at public health and like looking at what it took to get an MPH, but still was like on the fence about it because I was like, okay, if I don't, like, am I going to directly be a project manager after this? Like, what is that, right? Like, what, I don't know. Is that going to be a career for yourself, Shel? And it just didn't make sense. So I just, I kept working there to figure it out. And then that's when I moved home to see like, okay, how can, like, which one is going to be like, it was like a balance, right? Like, do I want to be like in the clinical space and like be this doctor or PA, because I also heard about physician assistant school then, or do I want to go directly into like this broad space of like public health and then figure it out that way? And to me, I was still teetering, right? Like I did not know, because to me, the PA in medical school, I think the what I saw in it was like, it was straightforward, right? Like, it's like, you do this, you get this job, boom, you're good to go, right? And then you get to help people. To me, I was like, that sounds easy enough. But when I heard of public health, I was like, ooh, this could be challenging, but like the space is moving really fast. You can be a lot of different things, Shel. You don't have to like be you don't have to like, you can be a lot of different things. You can be a public health manager. You can be a coordinator of another program, or you don't have to even stay in like communities. You could do like epidemiology. Like I started like figuring it out, and my mind said, Shel, go for the challenge, right? Go for public health, because you really don't know what you're getting into public health, but it could be a lot of beautiful things that happen. So do public health. So I got all those hours, loved my job being, a PCT, the most humbling job I've ever had. I tell people, like, I don't need you to humble me about anything. I worked as a PCT. I can change a bedpan in 10 seconds. And I can move people fast speed. So I don't need anybody to humble me about anything in terms of like healthcare, because being a CNA did just that. But I was like, let's go to public health school. Like, let's get this MPH and let's really learn. And like, Shel, you already have, people say you already have the spirit, right? Like, I don't think everybody has the spirit to help. I naturally, I think people are natural, like humans, and they want to be helpful. But I think public health, there are really special people in public health who really want to help, who get it. And I wholeheartedly believe that. I've met some amazing people in the public health space. But I was like, you take that energy, your personality to serve and be there for other people, with the education that you really don't know, man, you can really take yourself really far, Shel. So like, let's do this. So went through all that process, took the GRE, applied to about 10 schools. No, was it 10? I think it started with 10, and then I started to realize it got really expensive. I think I went to like 5. Applied to all the schools through that one, I don't remember what it was called, but it was like one platform. Yes, SOFAs. Yes. You apply, you go to all of them. And I, for some reason, was back in South Carolina and I wanted to go to Atlanta. I don't know. I think I thought about, I didn't apply to any schools in South Carolina because I was like, I need to like get out. Like, I need to explore myself and who I am in another city. And not to say that I couldn't have done that in South Carolina, but I wanted to do something different. So to me, I did my research, and like Atlanta and DC were like, at that time, like the meccas of like public health, right? Like the CDC was in Atlanta. I mean, DC is like DC, you got the Capitol, you got policy. So I was like, you gotta go to one. So I ended up getting into Georgia State, and I was like, oh my gosh, I'm going to Georgia State. I remember Drake talking about like girls in Georgia State. I was like, oh my gosh, I'm about to be at Georgia State getting my master's degree. I'm so excited. And like a week later, I got into George Washington. And I did not think I was going to get into George Washington. That was like the one school, right? It was a very, very competitive school. They had a program at the time, and I think they still were probably like another school has their concentration was community-oriented primary care. So COPC, right? Which is like really just comes from like back in like the health center world, where it's like how you connect public health, primary care, and community. That's really what it is, right? And how you intersect that and what does that look like? And I was like, oh my gosh, Shel, like this is exactly what you want to do, but this program is hard. You had to have this type of, I think you had to have like this GPA. I think I was like a percentage off or like 1 point off, but I still applied. So I didn't think I was going to get in. And I got into George Washington University and I said, oh my gosh, am I going to DC or am I going to Atlanta? And I had to like really do like a pros and cons list. And I picked George Washington. I was going to move to Washington, DC to pursue my master's degree in public health in community-oriented primary care and move to a city that I, didn't know that many people and start a life. And that was what happened. And those 2 years at GW, and so I knew I was in DC, right? So it's like, Shel, you got to take advantage of every opportunity. Like you cannot not do anything, like, right? And so a lot of what happens is like people, you go to GW and there's organizations that are like, I want a GW student. So I'm like, okay, I think I'm in the right place. Like Amari, I'll never forget. I wanted to work at the White House, an internship at the White House. It didn't have anything to do with public health, but I was like, Shel, you're in DC. We're taking everything by the horns. We're going to go for it. Let's do it. And I interviewed for them and they were like, we love you, but like, this isn't even what you want to do. I'm like, I don't, I can learn really fast. Like I just, I want to be at the White House, right? I wanted to stay an intern at the White House, right? Because I was like, you're here, Shel. Like you walk past the White House, this was a dream come true for, me. I remember having like one of fifth grade, trips to Washington, DC. And so like being here and living here, I wanted to take all opportunities. And so I would just apply to internships, like little small internships. So I started working for Pcori, doing like a research assistant for them. I would do like, working with like different counties, they would be doing needs assessment. I would sign up, I mean, anything that can give me an opportunity that I can put on my resume, I did. And so, I worked for the United Nations. I started doing like getting them ready for a conference, right? But like, I was like, you got to build this network. You got to see what's out there. You got to see about public health and, and be everywhere, network. That's why you're here. And so I did that. I don't remember what other jobs that I had because I had so many jobs in school, but I think that's what set me apart when it came to like start looking for real jobs, is that experience that I had with my degree. And then learning about public health, I loved my public health classes. There was not one public health class that I did not love. Like I loved my teachers. They were amazing people. I loved my COPC like cohort, like and how we learned, and like they put you in real world situations. So we would have like different like classes, and then we would have like the externship that would be like in like a health center in like DC, like in Northwest DC, and they put you in these spaces so that you can learn like like instead of just like having like didactic like let's do this, let's do that. And it was amazing. I learned so much. We got to like work in hospitals on quality improvement teams and like figure out how we help this this organization increase colorectal cancer screenings. I mean, like things like that I was like, I would have never known if I didn't. So I was always so grateful to be at GW, being around people. But I will say I did have like imposter syndrome, right? When I was at GW, because at this time I was not a traditional student. I was at that time like 26. That's old, usually, kids are going right, 23, 20, 22, 23, they are going into their masters. And so I had imposter syndrome a lot, like, am I supposed to be here? But like, I met a great group of people, and I mean, they're my friends to this day. And it really was like, we're all here trying to get what we need and then go on and be like amazing, individuals after we get our MPH. And so those 2 years flew by really, really fast.
Yeah, that they do, and I think it's really good that you shared that. You're like, okay, I'm gonna go to DC. There's just so many opportunities here. Let me apply for these internships that have nothing to do with public health, but there's just taking on different opportunities, seeing like how you can align yourself in just the lane. And I think that is a growth mindset that I think a lot of people aren't able to see and want for themselves, saying, oh, I should get all these, I should go for all these opportunities and things will come my way. They limit themselves. So I'm glad that you were able to do that. And it seems like it was a really rewarding experience. And I thought you were going to say that you're thinking about DC and Atlanta being like the black meccas and not public health meccas, but I guess a little bit of both. A little bit of both.
Yeah, probably a little bit of both, right? Like, you know, definitely probably a little bit of both, but like in that space, like Amari, I had like, you know, since being home and being in that state, like I really was like, I got to figure out this career thing, right? Like, I think I'm pretty good at this. I got to figure out. So like, I definitely knew like DC was very, you know, very black. I knew Atlanta was. That's why that Drake reference about him talking about the girls from Georgia State, I was like, oh yes. But it was really about like honestly the opportunities I can get with this graduate degree, right? Because I was, you know, in undergrad and I didn't have any internships. I didn't have all of this experience, and so I knew I wanted to be in a place that would allow me to take advantage of all the opportunities because they're already there. And then I learned that like there would be like specific job postings that would say for GW first years or for GWP MPH students. Like that's really, you know, what it that's what it really was. And then, you know, GW was a school that there weren't that many black people at GW. You know, DC was a black mecca thing. You know, you think of Howard and you think of just like growing up in DC, but GW was none of that. You know what I mean? Like there were a group of us. I was honored to be the president of the Black Public Health Student Network at our at GW in our public health program, and that was great for people to show like, hey, like let's talk about like minority health, right? Like let's talk about what that looks like, and like Black women and Black kids, and like how what their health looks like, and that was not like. I mean, you when you went to your your precepts and you went to your externships, you would see that that was like the composition of people there, right? Like it was just we went in these communities that had like majority Black people, but I don't think people, you know, especially in our like cohort understood until, you know, us as students said, hey, we need to talk about this, we need to do this. So I remember just planning this minority health conference that we had in February. And it was a beautiful thing. We had all of our friends, you know, from all of our different cohorts come and really support us and really like learn about the information. So that was like one of the moments I won't ever forget from DC. And then I just knew that DC was diverse, right? Like, so when you think about Black people, right? Like you're like, yeah, it's a Black mecca, but man, I mean, DC is a melting pot, right? And so you get to learn about all types of different people, who they are, what, you know, what they do in DC, you know, how they interact in DC. They're different neighborhoods, and what's different from a neighborhood that is like mostly Hispanic versus a population that is mostly Black. Like, I mean, it was so many different languages, so much. I learned so much being in DC. So it was a lot of different factors, but the main one was really like, Shel, like, let's go, like, let's get this, like, let's do what we need to do here and figure it out. And I end up, you know, learning so much more.
Yeah, that's awesome. And it seems like you were a sponge going into there and just really absorbed all the information as well as experiences. Was there any one, because I have like a bunch of internships here and stuff that you did throughout your MPH program, but I think you spoke to like broadly, you just did a lot of different things, try to get involved in a lot of different work. And I'll put the different positions that you were in the show notes and people can check your
I'm trying to
LinkedIn.
remember.
Yeah. So was there any one specific position or internship that you had during this time, junior MPH, that was like really pivotal in your thinking or anything like that?
Um, I'm trying to think. So I I think I know the one. I mean, they all were, right? And it was a lot. I told you, I I remember one time I had like 3 jobs and I was like, wait, why are you doing this? But like I just learned so much and got to meet so many different people. But I think one of the positions or organizations that I work for that was really like transformational. I keep using that word. Maybe I should add that to my word of the month. It keeps coming up. But was ARC, right? So the Agency for Healthcare Research and, oh, I might be messing it up, quality and, oh, I don't remember it now, but I think Agency for Healthcare Quality and Assurance. So it was something like that, but it was a government job, right? It was a government job. I had not in my wildest dreams thought I could ever work for the government. So it was a summer fellow program. I applied for it and I ended up getting it. And they, how it works, and you were making pretty good money then, right? You working in government. It was a summer fellowship. I made a great amount of money that summer, right? But really, what it did was I started to learn how how these government agencies work, right? And like what it is that they have to do when you work with a scientist or you work with a researcher. And so what my project was really trying to see how online communities, what benefit are online communities in terms of health, right? People get online sometimes and they feel support about conditions that they don't necessarily feel when they talk to their providers. And so we were trying to find this like systematic, like evidence-based like project or like program that could show like themes from people and how they interacted online and what they would say and how we could translate that into like an infographic, right? And like, or what we can learn from people online. And I was like, oh, this is public health, but this is like really cool because I feel like I'm still being creative. I'm able to like go online and see what people are talking about, like in support groups or support chats about like their conditions and, how they don't feel seen in their doctor's office. And it was like quick work, right? It was like a quick research, but I still sometimes go back and look at it, but we really started to like open up the thoughts and like ideas about using that as research, right? Like, it's not traditional research, but people are online, there, and they are telling exactly what we want them to tell doctors, but they are not telling doctors. And so how do we make this a system? How do we, get this information to them? And so that was like a beautiful, really short internship. I actually still speak to my my preceptor there. She talks about that research project and how they like have been writing papers about it. And, she was like, you were a big part of that, thank you for that expertise. And I was like, oh my gosh, yay. So I think that was like that was a cool moment for me, right? I got to work at this government agency. I remember like walking in like with my like government badge and like being like, yeah, I work for the government for the summer, but I was really doing cool work. And it was very different than the work that I had previously been doing, which is like needs assessment or working for like research assistant. It was like, I felt like I was working with these huge scientists or these huge people that worked in the government to kind of really find out like real life solutions to things that were going on. So that was like a really, really cool job that I had. Probably the coolest, they all were, but that one was like the coolest.
Awesome. And it was the Agency for Healthcare Research and Quality.
There you go. That's it. I hadn't said it in a while, but that is it. Yes.
Okay. Well,
I still have my PowerPoint project from like that time, and I vividly remember that time and learning a lot about how the government ran and like even like their grants, right? Like when you think about like governmental grants, and like that was opening to me because I was like, oh wait. I mean, I knew like this was funded by grants, but like I think when you're in the thick of public health, you don't think about the budget stuff. And so that opened up my mind to like budgeting in public health. And like when you get grants and you have like a year one and year two, like how do you navigate the money to do what you need to do? And so they broke that down for me too in there. So I learned a lot of like transferable skills there as well.
Yeah, and that's always good to get those transferable skills and just as well as I think the exposure to government. Yes. And because as you said, you weren't really sure what it would entail, but you learned a lot going into there. And it seemed like you also had a lot of other great experiences throughout your MPH that were not specifically related to the government, that gave you exposure to different parts of public health, which is always awesome. Okay.
Yes.
So were there any other takeaways before from your MPH program before I move you on to the next question?
I think just like when you're in these MPH programs, like take advantage of all the opportunities, have relationships with your professors, right? Especially the ones that you really have a liking to, right? Email them, ask them if they have projects that you could be a part of. But they're also, most of the time, these professors are doing research themselves too, right? So you could be a part of that and, build these relationships in in your MPH program, so that when you need advice after MPH program, after the program, or you need to think about career stuff, you have them as in your network, and they remember you, right? And they're like, I had a relationship with this student. That's what I tell people, and that's what set me apart in my MPH program. I feel like it was like, hey, I'm here, like let's do this, and let's go meet this person, and let's do this, and let's be that. And that's, I think, really like making sure you are intentional when you are in your program, because those 2 years will fly by. And what I did not want to happen to Mari was what happened in undergrad, right? I go and bust my butt these 4 years, and then I don't know what I'm going to do after. I cannot do that for this, right? And so I had to change things up, and that's what happened. So yeah, when you're in your MPH program, enjoy it, like learn as much as you can, but also really network and put yourself in positions that you didn't know you could do, but you're in this position, and learn about public health. And I think that's what I learned. That's when in my MPH program, I was like, oh yeah, public health is huge. That's when I really kind of was like, oh yeah, you can honestly do whatever you want to do in public health, Shel. Like, I really remember saying that to myself, like, oh wait, you're working for the government? Oh, you're a facilitator for a needs assessment? Oh, you're doing behavioral health at this hospital? Oh, I was like, Shel, you can literally do anything you want, but like having this MPH will like set you apart, right? Like, it wasn't that it was going to be this thing for my career. It was just going to be something that was going to help me get to where I needed to, one, to, make the money I wanted to, and then to really like have the experience and education that I needed to keep moving along in my career.
Yeah, that's awesome. And one thing that I wanted to highlight that I forgot a little earlier is that you said that in your summer fellowship you were doing work around like social media groups and things like that. And I just wanted to point that out for people who might be in the MPH or might be in the bachelor's program, that is a thing that a lot of people do, like scraping social media or going into social media groups and getting themes and getting like just qualitative data. So if you're interested in doing that kind of stuff, reach out to professors or just people doing that kind of work, or just research it. It's pretty simple to do a lot of this type of work as well.
Yeah, for sure.
Yeah, it's a little hard on
I didn't know that was a thing.
Me either until my MPH program. I was hearing like other students talking about going on Twitter and like scraping data and then using that to create, like, to look at themes within like different topics that they were doing. So yeah, there's a lot that you can do. That's for sure.
Yep.
Okay, so you graduated from your Master's of Public Health program, and then you became a community health education specialist at the University of Texas Health Science Center at Houston. Am I correct in saying that?
You are said it perfect. Yeah.
Okay, awesome. How did you come across this? You said that in your MPH, you're setting yourself up to get a job that you wanted. So how do you come across this role?
Yep. No, great question. So I also left out that not only did I want to go to Georgia State, I want to go to Atlanta or DC. I wanted to move to Houston, right? So you might have been right in terms of the themes, right? I wanted to be in the Black Mecca somewhere, right? And I didn't know where. But I wanted to move to Houston. I don't know why I was infatuated with Houston. I like make a joke that like Beyonce lived there. So I wanted to like be there because she was there. Meanwhile, she like hadn't been living there. But that was like an ongoing like joke to my friends. Like, I'm moving to Houston because Beyonce lived there. And I am a fan of hers, who she is, how she shows up for herself, her work ethic. Just overall, I just think she's a great person. I don't know her. I hope I can meet her one day. I've been at a lot of her concerts. But so I just say all that to say, like, I was like, I'm moving to Houston. That was one of the things. But I got a rejection letter from UT. And I was heartbroken. I was like, not that I put in all this work to like do this like amazing essay and take the GRE and apply for this school, but I did not get in. And so I was very, very hurt about not getting into UT. And then Georgia State was next. And so I just went with Georgia State, right? I was like, you know what, to let the heartbreak go, I'm going to just go to Georgia State. And so again, going back, fast forwarding, I went to GW. And so I said, Shel, let's go to Houston now. Like, let's do it, So I said after GW, so like, again, it was like, okay, Shel, you graduate in August, you need to start applying for jobs now, right? So that it can be a smooth transition. So I think me and my friends, I'll never forget, we would have spreadsheets and we would apply to all of these jobs, right? Like We had spreadsheets. We would go sit in our, like, we had an apartment together. We would go into like our library and we just sit there and just apply. I mean, I probably applied to almost like 200 jobs, right? Like, and what I was learning is like, maybe I needed to change stuff on my resume, right? Like, instead of putting, I wanted to move to Houston, Shel put Houston, Texas on there, right? Like, that's just a tip. I don't know if it works, but when I started to put Houston, Texas on there, it worked. Or it didn't work. It still wasn't working. So I was applying, and I went on LinkedIn. I don't remember ever like LinkedIn. I think LinkedIn is a beautiful thing now, but back then I don't remember like LinkedIn being like something like very like less like this is what you have to do to get a job. But I went on LinkedIn and I saw that UT had a job, and I saw that like I had a connection from a young lady who I went to Hampton with. And I was like, she looks familiar, but I don't know if I remember her. So, but I just like reached out to her on Facebook instead, right? And I said, hey, I think your sister is connected to me on LinkedIn and she works in Houston. Is there a way that like I could send her my resume and she could like refer me for a job? It was like a wild shot. I did not know if it was going to work. She was like, oh my gosh, like, yes, like I'm glad you're doing well. It's good to see you. Yeah, I'll connect you with her. Amari, I swear to God, what happened was next, it was like, okay, somehow she put my resume on like the supervisor at the time for this job. And I got a interview, and she said, well, when are you moving to Houston? I said, I think I'm going to come in. I graduated in August. I said, I'm going to come in October after my birthday. She said, okay. And I moved to Houston, Texas. I packed all my stuff up into DC. I went home for a little bit in South Carolina, and then I drove from South Carolina to Texas to start my new job working at UT, which was the college that I actually got rejected from to get my MPH. I was now going to work for UT with my MPH from GW. So that was like a yes, I'm doing this. It felt good, right? It all made sense then, right? That's why I tell people, keep going on your journey, because man, it does not make sense when it happens. But I think back like, wow, you got rejected from this school. Now you're about to work for the school with the MPH that you wanted, but not from the school. And you're about to do great work. You're about to go into this community. They're building these new health centers like around the city, and they want somebody to come in to do some education. And I was like, oh, this is perfect. This is exactly like kind of what I wanted to do. This like kind of was like the job I thought about when I wanted to get, when I finished my degree, because I wanted to get into community health and like community education. Again, it brought me back to, the National Urban League, the Columbia Urban League. And I was working with the women. It reminded me of that. So I was set. I was like, oh my gosh, this is amazing. I'm in Houston, Texas. I loved everything about Houston when I moved here. The job was amazing. I was learning so much. I was creating curriculum because it was a new program, it was a new center. So I was a part of like building the programs, the educational flyers, like all of that. And so I was like, oh, I felt like I felt unstoppable. It all felt like it was all coming together. And then boom, another little like, not roadblock, but another like, what is it, a yield sign came up in the path, right? And so I didn't bring up this job, but I worked at the National Association of Community Health Centers, so NAC, and I was a policy intern for them because I wanted to think more about policy. Like, I want to learn about policy and how having data really can tell your story about your program to be able to initiate policy. Like, I was very curious about that, but I didn't know. So I applied for this internship, working for NAC. Loved working for them. I actually worked for them for 2 semesters. And then I like had to go because I was no longer an intern, and they did not have a job for me. They were like, oh, Shel, we don't have a job right now. But like, they were working on this social determinant initiative. And I was like, ooh, they were like, we don't have everything together yet. So, I was like, okay, Amari, 6 months in, I'm in Houston. I'm loving it. I'm enjoying this new culture, meeting so many different people, loving my job still. And my old internship boss from NAC calls and she says, hey, Shel, can we jump on the phone? And I go, what's going on? She says, we have a position open. We have a project specialist position open for the Prepare project. And we want you to be a part of this. When we thought about this role, we immediately thought about you. We know this is hard because you just moved to Houston, and we knew how much you wanted to move to Houston, but we felt like we would be doing ourselves a huge disservice if we did not like let you know and see if you wanted to interview for this position. So I remember I was sitting in my office at UT like, wait, what is happening? I mean, I'm very happy now, and I'm this is like what I wanted. What are they telling me? Like, what is this? What is happening? And again, I say another thing too, right? Is like when you're going through these life journeys, like having faith, right? And just like letting things happen and like that leading you. But the Prepare project, I was interviewing for, I had my interview 2 days before they actually came to Houston. The odds of them having a training session in Houston, Texas, when they're in DC 2 days before my interview, I said, okay, God, what are you trying to do? Like, what is this? Like, what are we doing? I got to sit in on their training. I got to really see what the curriculum was. I got to meet, I already knew my colleagues, right? And I had dinner with them, and they were like, Shel, we hope you take this position. I hadn't even interviewed yet, right? And so I interviewed, I got to learn more about the position. And I was stuck. I was like, you had just moved to this really amazing city that you wanted to move to before you got your MPH, but now you have this opportunity to be a part of this national initiative around social determinants of health, right? And data, and like this is going to be monumental work, and you get to be a part of this, and at a national organization. You would be making more money, but you're going to move back to DC. And do you want to leave Houston? And I struggled a lot to make the decision, but then I realized, I had those talks with myself. I did another pros and cons list because that's what I always do. And long story short, I made a decision to move back to DC, right? And I worked really hard for this career, right? I think I go back to that undergrad Shel, right? Undergrad Shel didn't know what she wanted to do. And now here you are, this really unique opportunity in public health, really getting into social determinants, which is what I wanted to really get into. I mean, I still want to do community health, but I like social determinants, and I learned about like the data that you can have, and like helping people find like the intervention and resources like within their communities, or like being able to find out the data to be able to get more resources in the community. I was like, I have to be a part of this program. So in those 6 months, I packed everything up, drove from Houston to South Carolina, stayed in South Carolina for a little bit, and drove back to DC.
Wow. Wow. That's amazing. I guess it was a hard choice, but a choice that you definitely made, and it seems like it worked out in the right way, like talking to you now. And I guess we'll talk a little bit about that. So tell me, what did you do when you got here in this prepare program?
Oh my gosh. So the Prepare, so I was essentially a part of like training and technical assistance, right? So me and my colleagues, they created, and I was a part of the team. So I always say we, I love that about that team. We created a questionnaire to ask questions around social determinants, the domains, right? When you think of transportation, when you think of support, when you think of education, when you think of income, we had questions, right? Because what we knew about health centers, where they were already asking these questions, they were already collecting this data. They were not doing it in a systematic way to be able to then see some change, right? See some policy change, be able to have the data to go and, go to different organizations and say, hey, this is what's happening. They had like the anecdotal stories, right? Or they had like the 2 or 3 patients that was dealing with this one thing, and then they found resources immediately. But we thought that there was like a lot of like great things that could happen with this standardized data. And so what we did was try to help health centers around the nation, small or big, no matter where you were in terms of resources, how they implement Prepare in their workflow, right? In their clinic workflow, how in their communities, in their organizations, how do they ask the questions? We like really were thinking through, we had this toolkit, this amazing implementation toolkit that took you from like step to step. How you set up the data, how do you get the data? Once you get the data, what do you do with the data? How do you do the interventions? It was like beautiful, but what we were doing was we were taking all of the lessons learned and then pouring it back into the different health centers. Like, right, like, hey, this health center did this. started to have some use cases. Like it was this health center who like knew that they had patients who were not coming to their visit, their appointments. They knew they weren't coming because they didn't have transportation. They didn't have, the bus routes were too far. So what they did was they asked the transportation questions to about like 25 patients, put all the data together, took the data to a Department of Transportation meeting and said, hey, this is what's happening with our patients. They are not coming. Can we figure this out? We are getting more data, but this is the data we have. They end up like getting bus vouchers, as well as taxi vouchers. And what happened, because they had the zip codes, they were able to geomap where the individuals, patients were in the city, and be able to put more bus routes closer to those individuals, right? And that was just like having a little bit of data. So like, we were like, this is big, right? Like being able to have this data when you think about reimbursement, right? A lot of these health centers are not getting reimbursed for being able to provide a resource for an individual who really needs it, because it's social determinant, right? It's not like a clinical factor. And so we like were working through, with organizations and health centers who like were really taking the policy lens. Some people were taking like the risk stratification and like, how do you bring that into, it was so much going on, and it was beautiful because what we were doing was like, again, lessons learned, learning. I enjoyed working for that organization so much. NAC is still very close to me. I still talk about Prepare all the time. My team, it was great in terms of development too, right? In terms of not just in public health, but like, who was Shel like as a colleague, right? As a worker, like what strengths does Shel have as, as someone in public health, it was just the best decision for my career. I don't know if I would have been able to get that much experience and really learn that much in terms of the social determinant health disparities world if I would have stayed in Texas. So again, I just say it's full circle, right? Again, it's that full circle time. I worked there for like 2.5 years back in DC. I will say going back to DC after grad school was very different. Because your networks are very different then. You can't go back with like your friends from grad school again. You have to build these new networks, meet these new people. People want to meet you and know who you are based on where you work. That I got a lot of those, right? It wasn't like, I want to know who Shel is. It's like, no, I want to work where you work. So like, let's go get some coffee so I can figure out what you do so I can get there too. So I had a lot of those. So that was like very different, but it had gotten to the point where it was moving really fast. Prepare was like in different languages then. It was like in 80% of health centers around the nation, and they were going into a different space that didn't necessarily need so much training and technical assistance. They needed like more of like a strategy person, and I didn't want to be that. So I decided, it's time for me to leave the organization and leave DC. Very sad, but I felt like I had like gotten everything that I needed. Like it was like, it made me feel so much more confident in public health and where I was. But yeah, it was just time for me to leave. And I am a proponent of like, when something just doesn't feel right anymore, it's just time to leave and figure it out. So I had this master plan, Omari, so I left DC December 2019. I was going to say move back home, transition home, right? Like have home be like South Carolina, be like a basis, but I was going to go travel. I was ready to travel. I spent New Year's in Miami with my friends. In February, I went to Guatemala with one of my grad school friends. We was there for like 2 weeks. It was amazing. I think we were going to go to Colombia next. It was like, let's travel, Shel. You've been working really hard these 2 years. Let's travel. And then we'll move to Houston. And then the pandemic happened. And that's so, the pandemic happened and there was no more traveling, right? So March is like, okay, Shel, well, you haven't been looking for jobs. I left DC with no job. I knew I just wanted to go back to Houston, and I was like, I'll find a job, right? Like I have all this experience now, like I'll find a job. And then March came, everything slowed down, and I was back home in Charleston, South Carolina with my parents with no job. At that time, I was 32? I can't remember. My 32, 33. And I was like, oh my gosh, right, Amari? I'm thinking about that time I was like 25, 26, and I'm back home, and I was like, oh my gosh. I was like, oh, is this deja vu again? But I knew it was going to be very short term, right? But I also had never been in a pandemic before. So I didn't know what to expect, what was next. So I remember I was like, well, Shel, maybe this is, you should just take a break. Maybe you should rest. You're not vacationing, but maybe you need to rest. So that got old really quick. I'm a free spirit. I like to be like on the go. Like I like, okay, enough of this resting. I'm like, what's next? And it didn't make sense to me to move to Houston during the height of the pandemic. It just didn't make sense to me. So I was home. I was applying for positions. Nothing was coming up that was even, the job market was very slow. People were trying to figure out within their organizations how they managed the pandemic and working remote. A lot of jobs, especially public health, right, with funding and all that, they weren't bringing anybody new into that because things had just kind of halted. So I was like, oh my gosh, what am I going to do? I have to get out of South Carolina. So to be honest, from March to August, I was just trying to figure it out, and ended up finding somebody on LinkedIn that worked in the public health, Harris County Public Health, which is like the biggest county here in Houston. And they had like a similar to the community health education like role, but it was going to be around COVID, of course, right? Like it was like either contract tracing for COVID or it was like working with education about COVID. I didn't see any positions about social determinants of health. I didn't see anything about working in the community. It was like, if it wasn't about COVID, like that's all public health at the time in Houston was thinking about. So I was like, you know what, Shel, you want to get to Houston? Let's just do this. Like, this will be in the meantime. This won't be what you're going to do forever, but like, let's just do this because we want to get to Houston. So I said, okay, August, let's move. Let's go ahead and move. And luckily I had a sorority sister who lived here. And I said, hey, let me stay with you for like 3 months. I'm going to figure it out. I'm going to get this job and we'll be like, we'll be good. We'll be good to go out, be able to move into my own space. Houston's huge. And so I didn't want to just move anywhere and not know where I was moving at. So it was like amazing that I had her to like be able to help me navigate where I wanted to move. So I moved in August, and how about both jobs fell through? The contact tracing job fell through because they couldn't find a space. They couldn't find a building to have all the contact tracers there because it wasn't a remote job. And then the public health, the Harris County, they end up putting it back on the job market. So I said, okay, well, now I'm in Houston with no job again. Like, again, I'm like, deja vu, but I knew things were going to fall into place. I don't know. I just figured I knew it was going to do that. So, during that time, I was like, well, what can you do that's really good, Shel, that you're like kind of good at, you can make some money. I've always wanted to start a business. I have had an entrepreneur spirit, but I never had the opportunity to really dive into it. And I felt like Houston was the best place for that. I mean, to this day, I still feel like Houston has allowed me to think that I can do anything here, right? Like, and I don't necessarily know if I felt like that in DC. DC was great for my public health career, but here in Houston, I feel like, the world is mine. I can start a business. I can start 2. I can start 3. I can start a nonprofit. I can do whatever I want to do here because that's the type of city that it is. And so I said, Shel, you're pretty good at cleaning. Like, let's start a cleaning business. And I was like, wait, what? Am I really starting a cleaning business? And I started a cleaning business, but I needed to make some money, right? And, I had saved up money and I was ready to travel, but also like, the money was slowly coming down and I was like needing to like keep up my savings account. I started to clean a business. I started like asking friends, could I clean for them so I could take pictures? So I was like doing a lot of free work, and then people started to pay me, and then word of mouth. And it just grew and grew and grew. It's still growing. It's weird sometimes when I think about it. I'm like, oh my gosh, like you really have a business. And it's running by itself, if we want to be honest, right? And I didn't know that. And I'm still learning about what it means to be an entrepreneur. But at that time, it was like survival mode, right? It was like, you got to figure out what's next. And like, why not try to like jump into this passion? So that's what really helped me until I found this position that I work at now. So I work at I think I'm missing a step, Mari. I think I did get like a sales contract job. I was doing it was like a community resource. I don't want to talk a lot about it. It was great. but it was like 3 months and I was contract and it was like sales. It was like sales in public health. So I was like, wait, that's a thing? Like you can work in sales, but you also can like be community and be with community engagement and like going to different webinars and talking to different communities and learning about their needs. And I was like, oh, I didn't know that was a thing, but I was making pretty decent money at the time. I only worked at for three months because, you know, contracts are usually over. Then I started back into the cleaning. But September of last year, I started, well, no, in July, I started to get back onto the train of, I moved into my apartment. I was like in a good space. And I said, Shel, let's get back into public health. And you love public health. I know, you know, you feel like it's kind of burned you a couple of times, right? But like your heart is here and like, you got to keep, I feel like I tell myself, I got to keep showing up for her. Like I got to keep showing up for that side of public health that is like there and it's like never going anywhere. So I got back on LinkedIn, got back on Indeed, and was just like looking for organizations to when it felt good, right? I knew I did not want to just apply anywhere. It had to feel something good. And I like nonprofits, right? Like I think that's the part of public health that I really love. A lot of people, you know, don't necessarily go into nonprofit because, you know, if we're being honest, nonprofit doesn't give you a lot of money in public health. You know, you think you're like, oh, I got my master's of public health and I'm going to work for this nonprofit that is not going to pay me. But nonprofit, I love nonprofits. I think the work that they do, you know, you think about like, oh, like they do this much with this less resources, but it's the people in nonprofits that really get you there. And so I have met amazing people. And so I was like, I got to work for a nonprofit that is really going to like be that thing for me that I need to get me back into public health. So I applied to the American Cancer Society, interviewed for them, didn't get that job, applied for Susan G. Komen, interviewed, didn't get that job. I applied for the national, what is it? The MS Society, didn't get that job. And I'm like, okay, well, shoot, what is happening, right? I'm like, well, Shel, maybe don't go back into public health. Let's think about something else. I'm like, no, it's going to happen. And then my last interview was with the Epilepsy Foundation. And what I liked about the Epilepsy Foundation is they were trying to get into this digital space, and nonprofits usually were not getting into that, right? It was still what they were, you know, nonprofits do what they do and they do it best, right? But I love the innovation, right, of Epilepsy Foundation being like, no, like let's create this digital app to help individuals with epilepsy be able to manage and track their data. And I'm like, oh, you know, I started thinking about like, I was like, an app. I was like, this this nonprofit wants to create an app to do this. And they want somebody to be the person to engage with this community and learn about this community and figure out, you know, what they need and how we put it in the app. And they're like, yes. And I was like, okay. Like I felt very intrigued because this was also something new in public health. I'd never gotten into like that digital, other than the online community stuff that I did with art. So it brought me back to art. And so I started working with the Epilepsy Foundation, and the amount of information I'm learning about communities is like really nice, right? And it's still, I don't know in my mind why I thought like I wouldn't be able to like talk about social determinants of health in this community. You know, I think sometimes when you think of FEOH, you think of like, you know, you hate to say it, right? You think of like Black and brown people, but there are social determinants of health in every different population, right? And I think I learned that because working at the Epilepsy Foundation, and I don't know why I thought that before, or maybe that was just like where I was in DC, the communities I was in, I didn't see, that's just all the numbers, all the research was always around Black or brown people. And it was always like comparison to white people, right? Comparison to Asian. It was never. So when you think of it and you think of epilepsy, which is like, you know, a white disease, I was like, oh, there's no social determinants here. And it's like, Shel, yes, there is, right? So I got to learn this, and I feel like I still have my social determinant cap on, but I also got to get into like, how do you engage with individuals with a digital app and virtually? And so I'm learning a lot, and I've been there, it's almost like been 6-7 months, and I love it. I love working there. I love the people there. I love, you know, just like the newness of it, right? Like always trying to think like, what can we be doing next? Or what is this? And how do we do this? And I think that's the thing of public health. It's like community and collaboration and relationships that we lose sometimes when we're in these public health spaces, because we want to get the work done, but it's like all about the people who you meet and how you do the work best. And that's it's being with people and building those collaborations. So yeah, I'm back in public health and I am loving it, but I'm also still, I'm still being able to be at the creative shell that I am, or like dive into that, or I even say like I get to like figure out what my hobbies are, right? Like I don't know if I ever sat down and was like, Shel, what do you like to do outside of like public health or like being an entrepreneur? Like what else do you like? And so I have some time to like say like, actually, Shel, like you like going to like athletic games in Houston. Like, I grew up in South Carolina. We didn't have any like professional teams here. Every team is professional. So I really like going to the games. I really like going to the Rockets games, the Astros games, the Texans. I mean, like, I was like, this is a hobby of yours. You like to do this. And so, I feel like I've been able to pour back into myself, but also still like doing the work that my heart loves, which is public health.
Okay, that's awesome. And I appreciate you walking us through that entire journey. And
Yeah.
because I know that part especially probably was very, very difficult with you just like going out traveling and whatnot, and then pandemic hits, and then you're kind of just in a very weird space. But shout out to you for persevering. Shout out to your friend for letting you stay at her place while you were
Shout
figuring
out
it
to
out.
her.
Yeah. Like I've heard many a times on these podcasts, just those people who have been there to like give you that space to find your feet and just get back like to where they know you can get to. So I appreciate all those kinds of people that take their time and give their space and their energy and whatever to help others. So that is awesome. But yeah, that seems like it was definitely very challenging, especially as you got those couple of rejections towards the end. But I'm
Yeah.
glad that you found yourself in a space that you're happy and that you're continuing to learn the work and do great work. So we appreciate that, and we appreciate you sharing all of that, as well as it's dope that I think like a lot of people look down on cleaning businesses, but cleaning businesses are one of the best businesses for like cash flow. They make a lot of money and people don't think about it in a lot of senses. So shout out to you for starting that as well, and like betting on
Yeah.
yourself to do that, which is awesome.
Yeah, no, like you said, it's people don't think of it because it's a grimy job, right? But the way you market it and the way if you find employees and people that really like love what they do and they do it really well, I mean it it's sustainable money. It's easy. It's easy money, right? I think of it like even in terms of being like when I think of like employees, right? Like, you go in, you get paid weekly, you go in, you get your tips. I'm still learning about the business, right? And what it takes and what it is, but it it makes, I will just say it makes money. It it makes money on its own, right? There's not a lot that you have to do. You just have to find the clients, right? Find the right people and just keep growing and growing. So I also see, all of the things that are in my life are ways to help people, right? And so public health is that, right? But made to win, I think, me creating this has allowed for other people to have like opportunities to make money, right? I was in that space where I wasn't making money during the pandemic. And so I still feel it as an outreach of my heart and outreach of who I am to be able to start this business and, like you said, bet on myself and have confidence in myself to be able to help others. So I'm still, that heart of helping people is still there, and I now see that now. And as I got older, I don't know why I thought that I couldn't do other things and like it had to be one thing, but I have learned now that like all of the things that are in my life are to help people. That is who I am. I feel like I am not a healer, but I do feel like, I have a unique opportunity to be able to be a part of people's lives and put a smile on their face or be an anchor to something they need. And I'm going to always hold that and keep that with me. That is never going to change. So I'm glad that I get to do that again now with public health. I have a lot more confidence in public health because I did lose a lot of confidence in public health. I'm going to be honest, right? And so now I feel like it's back, it's invigorated. And then now I'm able to also pour that into other opportunities or other, experiences. So it doesn't feel like it's just public health that is making me feel like this is the only thing that you can do to help people. Like my life is all about helping people right now. It feels like that. So yeah, overall, it's just like when you ask that question, how are you? I am in a really good place. Like, I just, everything is falling together in a very, very beautiful way. Of course, there are days where it doesn't seem like that. You have a hard day, nonprofit is not easy and it's not always hard. You take L's in business, but overall, I really feel like I am where I'm supposed to be. And that feels so good to say that, because I don't know if I felt like that, when I go back to talking about honoring, protecting that little Shel, I don't know if she would have said that now. So it feels so good to say, like, I am exactly where I'm supposed to be. All those things that happened was a part of Shel's journey. And it only, and it's my journey, and it can be, I was able to accept those things, move on, and feel the feels, but it's the beautiful journey that is mine. And I hope to continue, if I hit another roadblock, I hope to continue to learn from it. And yeah, man, public health, it's it's ingrained in my life.
Awesome. And I just want to say, like, yeah, it's important that we don't silo ourselves or put limiting beliefs on ourselves. And there's a lot of work that is being done to help people that is not specifically public health or it's business wise, but it's assisting people. And I think like that's important to highlight there, as well as shout out to you for being able to pivot so much, especially during the pandemic, and make it out. And then like on this line, so where would you like to see yourself in the future, let's say like in 5 years time?
That's a great question, right? And so I've been thinking about that, right? And I actually had that question asked to me in my interview at the Epilepsy Foundation, right? And so I thought, when I first got into my MPH, right, you see, I remember being at ARC, right? It was the first time I saw like an individual that was like an MD, a PharmD, he had an MBA, he had an MPH, and I was like, oh my gosh, right? Like, how did you get all these degrees? Or like, he was like the senior, like title, at ARC. And I thought like, okay, Shel, you got to keep moving up. You got to keep moving up. But I am in a space in public health where the title means less to me now. I just want to be in an organization where I feel seen, I feel felt, I feel like my work is valuable, and I feel like I am really benefiting the community. And so that's where I see myself in 5 years. I don't see myself in one role. I don't see myself being like, I remember thinking like, oh, you have to work for the CDC. Like, that's like the huge point, like what you have to do. And I'm like, I'll take the experiences, right? So like a big part of my community, my public health, was I got the opportunity to be a speaker at the CBC, Congressional Black Caucus. And I would have never thought I would have been able to be a speaker, right? You think of like these big names, you think of like, these big organizations. And here I was on this panel with these amazing speakers talking about food insecurity in our communities, right? And how we have to find resources to help individuals in these communities. And like, that's the type of things I want, right? I want the experiences, not necessarily the title, right? Like, I don't have to be the senior director. I don't have to be the CEO, or I don't have to be the senior project manager at any organization. Just being at an organization and having the experiences to express my concern and like provide solutions to like the things that we really need help on. Like, that's what I see myself doing and being. I will say, because I think it's important to put things into the atmosphere, I have been very interested in like tech, which is new. I didn't think that was a thing. And I think I have a really unique opportunity to get into health tech because public health and like that health background and public health and, thinking about like designing like an app for someone in health and like, like this won't work, this could work. I'm very interested in that. I won't say I'm not in the beginning stages of even thinking through that, but I have thought about it and I didn't. So that makes me excited because it's a brand new, thing in my mind. And, in this space now, and I'm like, if I want it, I'm going to get it. But I have thought about that too. So there's a lot of things, right, that I've been thinking about lately, but I want to do really good work right now with the Epilepsy Foundation. I'm really excited about where this project is going with Eden. Shout out to Eden and the Epilepsy Foundation and my team. But I see myself just being in public health, being in an organization that just does good work, right? Like good stewards of good work. And And I get to be a part of that and put my name on that and put my expertise and my experience and my knowledge and, put that into the work. So that's where I see myself in 5 years, not a specific title, not at this organization, just at a place that gets it, that gets the work that we need to do, because, healthcare and public health aren't going anywhere. We really have to have some change leaders and some thought leaders really be in this space to really be like, this is what we need to be doing. We have to keep educating people. We have to keep training like doctors and medical positions in this field around social determinant and disparities. We have to, there's so much work. We have to think about data, right? We have to think about policy. We still got to always think about, I don't even bring it up anymore because it's like a dub of, we got to think about systemic issues, right? Like systemic inequality. I mean, we got to, you think like duh, right? But like the, where we live, how we live, like that is institutionalized, and we got to figure out how we can do that better and how we get people out of these communities so that they can then focus on health, right? So, and I think it's moving, right? We start thinking about digital, right? I think in the pandemic, we start thinking about like more virtual telehealth, right? Like what is telehealth going to look like in the next 2-3 years? I think there's really unique opportunities in public health that are going to happen and keep happening. And I hope our field is ready for that. I really, really do hope we are ready for that. And we are aware that things are going to change, and we got to start making some like upstream changes. Like I don't want to go back into like the terminology, but like you get on all these presentations and you hear all this work that is doing, but it's like, is this really like, this is going to be transformational, right? But like, are we really thinking like upstream about social determinants? Are we really thinking about public health in a way that like from years from now, you'll be able to sustain these things? And I don't know sometimes. I think sometimes we get really stuck in like the grants, right? Like you got a grant, you got a deliverable, let's get it done. So I don't know. Public health is moving very fast. It's growing. It's going to expand. And I am just excited to see where it goes.
Yeah, I definitely think there are a lot of opportunities, especially opportunities in that digital health space. And I think it's important, as you highlighted there, the environment in which you work and the culture that they have there is sometimes one of the major factors for someone feeling satisfied at their job and wanting to continue to work, as opposed to salary and
Yes.
other things that come along with jobs. So I appreciate you sharing that as well.
Yes, of course.
Yeah. Okay. So moving you on to the Furious Five questions I ask all guests. So number one, what advice would you give to a student trying to pursue a career in public health?
Your journey will not look like everyone else's journey, but stay on your journey and make sure you are being intentional about the job that you are in, the knowledge that you are learning and how you can apply that like in your, like always be thinking about what different things you can be doing. Cause I think that's the beauty in public health that I didn't necessarily know I thought of, right? Like you can do whatever you want to do in public health. So don't limit yourself. Don't limit yourself in public health, because public health is not there to limit you. It's there to help you think big and to think about all the different opportunities you have. So take advantage of all those opportunities and really just live out loud. I say live out loud in public health, right? Like learn as much as you can, because it's there and you can do whatever you want. But again, your journey will not look like everyone else's in public health. I don't know anybody journey who is like mine. Of course, like they have similarities, but there's no one person who has the same exact journey as mine. But it may have similar things, or they may be somebody who had a completely straightforward journey, right? They had a very traditional journey, and that doesn't take away from their journey, and it doesn't take away from mine, but you can learn so much valuable things from all of the different journeys in public health. But it's no one size fits all in the public health. I feel like you can be whatever you want to be in public health. And I think that's the beauty in it. So just know that it all will always come full circle in public health.
Great advice and insights. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Ooh, that's a good question. So my position is very new. I will say, what advice would I give? I would give, that's a good question. In my role right now, I'm still actually learning my role, right? But I will say is getting in public health is, of course, the passion, right? A lot of people have the passion, but there's also like skills that you need, right? When it comes to project management, when it comes to like writing reports, right? When it comes to different audiences, how do you tell the story to different audiences in public health? So public health is a lot more than, in position and roles and where you are in the organization. You really got to think about, again, what are your strengths and weaknesses so that you can already identify those. I think up front, I told my boss about the things that I didn't feel so strong at and what I want to work on, right? And then the things that I were really good at to try to like be better at, right? And so using roles now, find the organization, but using roles to be able to learn more and more and more, and then get that basis of, how you do the work in public health, because it all is like systematic as well, right? Like a lot of that is, it's a way you do the things you do and the way you report on certain things and how you say certain things. And so somebody trying to get into a role like mine is really just like already knowing what your strengths and weaknesses are and being like open to learn more and really jump into like the job, right? But being another thing, all in all, whatever role you're going to say, I'm trying to like whatever role you're trying to get into, always be yourself, bring that person. And because that's what's going to make you shine at these organizations. Of course, it's the knowledge, right? It's in what you know in your education, but it's really if they can see a passion or they can see you being a part of a project, right? And so then once you get into the position, then you bring in the skills. You bring in the skills that you have, and you really hone in on those skills, and you bring that to the table because that's probably what they are looking for. So I would just say being aware of your strengths and weaknesses when you get into different roles. And like, I think one of the questions I would always ask in my interview, and I'm saying this, so I hope somebody takes it, right? It's like when you're talking to somebody you're interviewing, you saying, like what strengths or what are you guys looking for that you need in your team or that you need in this role, right? So if they say they need somebody who is really good at reporting, or they need somebody who can really stay on the data part, or they really need somebody who can just engage, you know that up front so that you can then say, well, you either say, hey, I am really good at this. I have, I've proven myself, or wow, I'm really interested in learning more of like how I report and like how I do it. And I would love to do that with an organization, right? Like, I think that question really, for me, always, when I asked my supervisors after, they were like, that was one of the questions that set you apart because you really wanted to learn more about the role, not necessarily the organization or what you would be doing, but like, what could you bring to the role that they needed? And so that could be a good interview question if somebody ever needs an interview question.
Yeah, definitely add that to your list, everyone.
Yeah.
Number 3, what's something you're working on improving in your life right now?
Right now, what I'm improving in my life is like meditation and affirmations, like talking to myself in a way that is helpful, that is healthy, and then setting time aside to really just sit with myself, right? Like when you're really busy or you're doing all these things, like you forget to pour into yourself, right? You the days go by and you're like, wait, it's Friday. What did I do for myself? And so I try to like have like a routine, right? Like I'm trying to like work on that. I think I read something the other day, is like when you don't feel the passion anymore, at least you have the discipline. And the reality is like sometimes the passion and like life being like you being really, really happy, sometimes it's not always like that, right? I think it's a really important space to talk about mental health. This is mental health, awareness month, but like life gets hard, and you have to have the resources and the people and the support and, the personal things in your life to be able to help you go on and help you move forward when you have a really rough day or you have a rough week or you have a rough month. I think you got to find those tools and what works for you. So I feel like I have been pouring into my mental health a lot more, and it makes me happy. I feel happier when I do that. Or last night I meditated and sat and thought about where I was, and like I remember just sitting there and like my the lady who runs my meditation, she said like go to the place where you feel most happy. And last night it was like a green pasture, but it was like red clay mountains, and it was a sunset. And I'm like, I don't know where I am in the world, but I feel really happy. And like, I was there and I felt like I was like outside of like my apartment, right? I wasn't at my computer. I was like with Shel. And so that's what I feel like I've been working on, my mental health and like my spirituality, right? And like, just like, you know, that part. And I think that's going to help me be a better person, a better friend, a better daughter, a better sister, a better person to myself. And so that is something that I have been focusing on. And some days it's easy, some days like, or some weeks, like my routine like goes, and then sometimes I fall off, right? But like staying consistent and trying to always work on myself, that's what's been like really good for me. Like past times, right? Like going to like take some time. It's like, Shel, go to an Astros game. Like it's baseball season now. Yay. So like, you know, when are you going to go take yourself to a baseball game, right? Or like, you know, instead of like doing work and open up your computer, like go read a chapter in a book, right? Like just being more intentional about that time for myself. So that's where I am right now. And it feels good. Sometimes it's like, but it feels good overall when I really think about it.
Yeah.
So I always say I'm healing, but I'm not healed.
It's a process, right? It's a process. Yeah. Well, I'm glad that you're taking time around your mental health and taking those steps and building in those activities to really have self-care and like a daily routine, which I think is how it should be.
Yeah.
So yeah, I appreciate you sharing that. I definitely also have a meditation practice and other routines
Yay.
that I'll probably
Yeah.
share with everyone in some sort of episode later on. But yeah.
Yay. Okay. I can't wait to listen. Yeah. I'm always interested to hear what works for other people. Because I think that's how, you know, again, that's in public health, right? You like learning what is working, what's not, what are best practices, and you seeing if that works for you. And if it doesn't, you know, that's fine. But if it does, that could be a great practice for you to add. So like something really quick, Amari, I was talking to a friend who was, she's a mental health therapist, and she said that she doesn't tell her clients to not worry, because that's just not how the human brain works. We worry about things, we get anxious about things. So what she tells her clients who have like issues with anxiety or like worrying is, you know, once a day, you know, take your 5 minutes and worry. You call it worry time for your 5 minutes. You think about all the things you have to do, like tomorrow. Oh my gosh, I have a meeting tomorrow. Do I have to report? Like, you know, think about it all that time, you know, personal life. Oh my gosh, do I need to talk to like a friend about something I don't want to talk about? You know, do I have to have this hard conversation? Is there something I forgot to do? You know, whatever. In that 5 minutes, worry as much as you can, you know, cry if you want to, be mad, be like, oh my gosh. But after that 5 minutes, let it go, right? Like pray about it, do whatever it is that you do when you are like wanting to release energy. And she said, and then move on to your day. But she has realized, and just from her research, that, you know, having that time for people to do that is it does work for some people. It doesn't work for everybody, right? So you see if it works. And so I did that like, was that like a couple of days ago? And I was like, oh, okay. You know, I didn't think about it as much. I won't say that I did not worry anymore, but when I just sat there for 5 minutes, like as I'm getting like, you know, like like say you get ready for the day, you sit in 5 minutes, what are you going to do for the day? I did the same thing. I wrote down all my worries or the things that were like really heavy on my heart. And I just left it there. And I went on to like watch TV, and I was like, oh, okay. I don't know if that's going to work every single day, but it worked that day and it felt good. So it's just like kind of coming up with all these practices, and in our community talking about these things that are work, so that we can be able to take better care of our mental health, because we don't have these conversations often, right? About mental health and what's working and what things we should do. So I think the more and more you learn about what's been working for people, it's going to be just best for us in general. So again, like the storytelling of it, right? And sharing what, you know, the best practices and what's not working for people and what is.
Yeah, definitely. And I think just trial and error and going into those things and reflecting on it is very, very,
For
very important.
sure.
Yeah. Okay. Number 4, professionally, do you recommend anything?
Ooh. Professionally, do I recommend anything? Anything, I would just say really optimize your LinkedIn. Even if you are not looking for a job, share on LinkedIn, look at articles. People are sharing good things, interact and engage with people on LinkedIn. Share your wins, celebrate yourself on LinkedIn, right? I think I saw a young lady say, she talked about what she did in April, right? Her wins for April at her job. That's amazing that she was able to do that on LinkedIn, and people congratulated her and said, like, you're a superstar. Like, thank you for sharing this. I'm going to do this for myself next year, right? Like, stay involved with that network professionally so that you can see what else one is out there, two, what other people are doing. And then always being able to, like, read an article. I tell people, I don't know if I do it as well now, but like, read one article a day, just one article about public health, one research article, one publication. Try to read one a day. Always be able to learn. And whatever way that is that you do it. If it's YouTube, I know there's a lot of people now on TikTok, right? Like, whatever is the best way, but always be learning and always staying like ahead of the game when it comes to what's happening in public health, or like, the different research or different treatments or different, policies. Like, I think it's really, you will set yourself, you'll be really uniquely professionally if you know what is happening outside of just what's happening at your organization, but overall what's happening with public health, and like having those conversations with your colleagues and friends and family. I don't know, I always laugh about this, but like, my mom knows I have an MPH, but if you ask her what I do, her answer makes me very upset because she does not know what her daughter does. She just knows my daughter has her master's degree, but in terms of like what I do in public health, she has no idea. And I'm sure a lot of people that can like resonate with a lot of people when it comes to public health. So like, I always tell people professionally, like, always advocate for public health in your family and friend groups, right? Like, talk to them about public health, or like, hey, did you know that this is happening here? Or like, and I read this article and I'm going to share this with you just so that because I still laugh to this day when people ask them, oh, what does Shel do? They're like, oh, she has her master's degree. She's working at a nonprofit, but like, that's all that they know.
Yeah. And I definitely could relate to that in a lot of senses as well. But yeah, definitely. Thank you for that advice. Optimizing your LinkedIn.
Okay. Yes. And then something else. So I was like thinking like a book, right? Like, and so professionally, you can always be pouring into yourself, right? But I think for you to be a great professional in the field of public health, you gotta, it's a lot of personal, right? It's a lot of passion. And so a book that I will recommend, because I do think it has leveraged me and leveraged who I am and how I show up in public health, but it's Daring, it's by Brene Brown. So I'm like a big Brene Brown fan. But it's Daring Greatly. That's what, okay. Yeah, it's Daring Greatly. I have my book shelf right here. Okay, so it's Daring Greatly. It's by Brene Brown. And essentially it's how you have the courage to be vulnerable transforms the way we live, love, parent, and lead. So she really just talks about like vulnerability, right? And transparency, and like how that will help us be better people just in general. And I think you being a better person, and again, like how, you asked me the question about what am I doing right now and improving myself in my life, that's going to only make me a better professional. And so I say things like, pour into yourself. But this book, to me, I read it every year, the beginning of every year, because I need a reminder sometimes that like, Shel, like, your vulnerability is a strength of yours, right? Like, your transparency and how you told that story, right? I thought I was going to be scared to tell you that story because it's not a glamorous story, right? Like, that is not a glamorous story. It was hard. There was a lot of times where it was hard. I did not know what I wanted to do, but I feel like being able to be transparent and vulnerable about that is about my journey in public health. Somebody's going to feel seen, right? Or somebody's going to be like, oh, I remember that girl in that podcast. She said that this was going to get a little hard. So I'm just going to keep going because I remember her saying it, and it did get really hard for her, but she made it through. And so I think like that's my power, right? Like, that's my strength. And so this book, I always try to like recenter myself and ground myself and read this every year, like at the beginning and like New Year's, people are doing New Year's goals. I'm reading this book and like going back to see like how I be my best self. And that's being vulnerable. That's being authentic. That's being myself. And I think that's what I bring into my professional life. And that's why I'm like going to always win, right? Like, even when I feel like I don't win, I'm going to always win because I'm always going to be being true to myself. So I say that to say professionally, just show up always as yourself.
Yeah, that's definitely important. And I think especially for Black people to show up as themselves, especially in this week as well. So I appreciate you sharing that.
Yes, of course.
And then last but not least, where can people connect with you?
LinkedIn. Follow me on LinkedIn. I want to connect more on LinkedIn. I said that I professionally, that was advice for myself, right? I need to do a better job on LinkedIn to talk about the things that I'm doing, the articles that I'm reading, share, some bullet points of the like the main points that I got from the articles. I just need to do a better job of optimizing and engaging on my LinkedIn because, again, no matter where you are in your public health field, your network will still always be your network because you never know when an opportunity may present to where not that you need a new job, but maybe you want to get into a new leadership role on a board, or you want to get into an organization that is doing great work and somebody. Like, you still have to always be building your network in public health. So I think LinkedIn is going to be it. So I tell people to follow me on LinkedIn, Shel Lessington. That's just the best way to reach me. And I would love to engage with people on there. I do have a Twitter, but I don't remember. I think it's like SS Lessington. I don't know. Just follow me on LinkedIn.
Okay, awesome. We'll be sure to put that information to LinkedIn so everyone can connect with you on LinkedIn and just get some more insights from you. But thank you so much for coming on and sharing your story and being transparent about the ups and the downs and about your path, because I think that in itself is just valuable, especially to other people who might be dealing with the same things or might deal with the same things going into the future. And just you sharing that story and showing that you are where you are now, despite all those things that happened, is very, very important. So we appreciate you. Thank you so much.
Amari, thank you for allowing me to be in this space and telling my story. I think what you are doing is amazing. I hope you sometimes give yourself a pat on the back that you are creating a space for people to share, these stories about life, about public health. I know, like you call this the public health millennial, but like, this is like life, right? We are talking about, life things and what happens. And so you are creating a very unique opportunity. I wish you the best with your podcast. I can't wait to see, what is next for you in this space, what is next for your podcast, because what you are creating is really fun to, like, is this foundation to how we as a people are going to keep healing and growing. And so thank you for allowing me to come and talk and keep talking and talk some more and tell my story. Please know that anything you ever need from me, if there's something else that I can be helpful for, or I can connect you, we're on LinkedIn and you see a position, you let me know and I will make sure to connect you, right? And so we have that connection now, and I want you to always know that I am here in that space to talk more, or to even if there's something you're interested in, to give you more insights too.
Awesome. I appreciate that. And I'll definitely loop you into anything that's going on or any way that you can help. And please let me know if I can help as well. So housekeeping items. So housekeeping items, everyone. Thank you for watching or listening to this episode. Greatly appreciate it. If you have not, be sure to subscribe, to leave a like, to leave a 5-star review, and to share it with a friend. And if you want to check out some merch, you can go to the phmillennial.com/shop and check out some merch from the Public Health Millennial. And I hope that you like something there. But we will see you next week. Peace.